I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and I have some special guests today. Yeah. I have one more that's holding the camera that's going to get on here, but these are my peeling beauties. So, okay, we're going to switch, and then Steph's going to come in too. So these girls did a Rejuvenize peel on Monday, right?
Yes.
So can you see them peeling? Come on. Can you see the peeling on there? Let's zoom. Zoom.
You'll
Just walk.
Oh, sorry.
There, that's okay. We have a new cameraman today, but see how they're starting to peel. So they did our Rejuvenize peel, which is the strongest peel. You are really peeling, Jill. And the beauty of these peels is that you can do them in the summertime. So obviously we are, they're gonna wear sunscreen and make sure that they are protecting their skin during this whole process. But have you guys have not done Rejuvenize peels before?
No.
You have, right, Jill? So tell us about Rejuvenize peel.
So Rejuvenize peel is our deepest peel, and we usually the day after you're gonna feel just kind of tight, almost like you've had a sunburn, your skin's a little bit tight. The peeling starts the second day, so I woke up with this morning. And usually you'll peel for about 3 to 5 days after treatment. Treatment's very tolerable. We keep a fan in front of your face the whole time, and it just kind of blows it away. And so without the fan, there is a little bit of burning, but with the fan, it's very, very comfortable.
And you said you peel 2 days later. So a lot of people do them Wednesday night, Thursday morning, and then that way they're peeling over the weekend. And with Rejuvenize, you'll peel how long?
Typically about 3 to 5 days
Okay.
for both Vitalize and Rejuvenize.
Oh, okay, so you do peel that much with the Vitalize. So the lowest level is our Illuminize, and you don't have much peeling with that, right?
No, and sometimes not at all. Illuminize is like your before main event peel. You might have some real light surface peeling or no peeling at all, but it will make your skin look brighter.
Okay, and then you guys have done Vitalize before, so
Yes.
who wants to talk about that?
I can talk about Vitalize. That's the middle strength, so it's going to make you peel a little bit, but I definitely didn't peel as strong as I have with Rejuvenize. Now, once you start doing them regularly, I peeled the most with my first treatment, and the more treatments that I did, the less that I peeled with Vitalize.
Okay, which, I mean, it's good that we're not peeling as much as Jill, but because you just had when was the last time you had a Vitalize?
Oh,
It's been a while?
It's been a while.
Okay.
Oh,
But,
we did it at the same time.
In the fall, but we've done a few microneedlings since
Yes.
February. I think we decided you've done 3 since February, but you had
Correct.
done 2 prior to that. So it could be why she's not peeling as much as Jill right now. And you're kind of in the middle. When's the last time you did a peel?
It's been about a year.
Okay, so it's been a little while.
Yeah.
So it was time. It was time for
Yes,
sure.
for sure.
And I'm asking all these questions because I don't really do peels. I have extremely sensitive skin. Now I could do the Illuminize. I don't have any problems with that. But that's why I'm asking these girls, because they're pro peelers, but I don't do them as much. So they're not for everybody, but we do. I mean, the majority of our patients can do peels without any issues at all. We do a ton of peels. So it is something you can do in the summertime, which is why these guys did it, and it's something that you want to maintain. You don't want to stop everything in the summertime, so you want to go ahead and continue to peel. Now, if you decided that you want to do peels, you would call up here and we would do a Vitalize first. We don't ever jump anybody into Rejuvenize because you really need to see how your skin reacts to that Vitalize. And then the other important fact to know is that you have to have your at-home treatment, so you have to be on product at home. It's silly to come in here and spend money on peels or our secret or Ultherapy even, I mean anything really, and not take care of your skin at home. So we think of our treatment at home, we think of our skincare as treatment at home. So let's talk about products that you're on at home.
I love the Aha Baha cleanser, so I start with that. Recovery, Lytera, HA5, and sunscreen. And my favorite sunscreen right now is the Color Science Duo, the total protection for the face with Unforgettable Brush. In fact, on days where I'm not wearing any makeup, I just wear those 2 products, and I do that a lot of the time, especially if the peel gives you good results, and then I can get by without makeup and just those 2 some days.
That's awesome. And one of the things, the reason why you're doing the peel is because you have some melasma. And so melasma is not something, I mean, it's hormonal, it's pregnancy induced a lot of times, but it's not something that we actually can ever get rid of, unfortunately, so it's more of management. So that's why you're using your Lytera. Break down each individual product, why you're using them.
So the Aha Baha cleanser, it will help with exfoliation for the melasma, and I also do get hormonal acne, so it helps with cell turnover rate to increase that, and that will help lighten the skin. It's a brightening cleanser as well. The recovery is for collagen production. We all want the anti-aging products, so that's for collagen production. Lytera is to help reduce the brown. It's also for brightening. HA5 for hydration, and then obviously sunscreen is to protect from the sun. But I did forget to mention one of my favorite products that I use as I'm going through it in my head. Retinol. And retinol is great for the hormonal acne, but also for anti-aging. It helps a lot with the cell turnover rate. As we get older, we just start to build those cells on our face when young kids are constantly turning over those new cells. So it forces that and gives you a lot brighter skin.
And what about supplements? Because you're big on our Skin AccuMax, and have you done the hair, skin, and nails?
No, I need to. But the Skin AccuMax is for hormonal acne, but it also can help with teenage acne as well. And it's a supplement, so it's not like taking an antibiotic or going on Accutane, because it's actually good for you as well. It's got a couple other vitamin A and a couple other vitamins in it that will help brighten your skin. But it basically is like eating 12 heads of broccoli a day, and with that it shifts the hormones and helps a lot with hormonal acne. As far as the peels go, I don't think we mentioned how often. So
good
we
idea.
recommend a series of 3 or 6, depending on what we're trying to work on. And they cover a lot of different bases, so fine lines and wrinkles, pore size, sun damage, acne.
Collagen stimulation is
Collagen stimulation as well. So a series of 3 or a series of 6, and every 4 weeks is how often we do those treatments.
Okay. And I realized, since you said we didn't talk about that, I realized I didn't even introduce them. Now, if you come to us, you know who all these beautiful gals are. But this is Jill. She's our nurse, and she's actually been with me on and off for about 10 years now. This is Allison, and she does our hydrofacials and is also the greeter. Front desk coordinator, I like that much better. And so if you call, a lot of times you'll get Allison, or you'll get Steph, who's also our front desk greeter, and greeter.
Greeter.
Yeah. But she also does all of our social media. So if you ever have any questions about anything, you can private message, and Steph is the one usually who answers. Occasionally you get me, but so sorry I did not introduce you. But you all should know them by now. So let's talk about products that you use. And Allison, well, both Allison and Steph are part of the book model thing that we're doing. And Allison sent me some of her acne photos from, how long ago were those?
That was about probably 2-3 years ago now. So it was before I started here, and that's why I did my peel, is for acne, very acne prone. I've got most of it under control now, so I just have that scarring, which the peels will help to treat. Usually when I do a peel, it will kind of purge my skin and pull some of those pimples to the surface, but then they clear up after you're kind of done peeling. For products, I do our TNS Recovery Complex, and I use that somewhat for anti-aging, but also to help kind of heal some of my active acne as well. I use our Lumavive system, which is one of my personal favorites, because I feel like as soon as you apply it, you start to glow. I feel like those results are instant for me, and it's a day and night serum. So the daytime serum is helping to protect your skin throughout the day from specifically blue light, but a lot of other environmental factors. And then the nighttime serum is helping to really restore and repair your skin as you sleep, because that's already what's happening while you're sleeping, is that repairing process. So it just kind of helps boost that process. And then I use our retinol, one of my favorite products as well. That really will help with my acne. Sometimes I just use it as a spot treatment. If I feel like I've got one coming on, I'll just spot treat, or you can use it for a full face treatment as well. And then I use our Ultra Sheer Moisturizer. It is oil free, so being acneic, that is a good moisturizer for me. And then I use all Color Science cosmetic products for my sunscreen and makeup.
Good. Neither of you mentioned Total Eye.
Oh, I love Total
I forgot that one too. I forgot that one too. So Total Eye is an excellent product for under the eye because it helps with the dark circles, it helps with the crepiness, it helps with the fine lines and wrinkles, but it also has an SPF 35, and you can use it on top of your upper eyelid as well. And so it's a treatment product, so you get a little bit of coverage, you get your SPF, and then you get treatment of fine lines and wrinkles. So that one, I think everybody needs that one. I can't live without that one. So
Yeah, I agree.
So okay, Miss Steph.
I am on all the same products. They are Recovery, Lytera, Lumavive, Aha Baha Cleanser. Retinol is my favorite. It helps dry up those breakouts. I use all the same products in conjunction with the acne system because I have really acneic skin too. I love the purifying cleanser with the Aha Baha. I'll switch those up every other day with each other, and it helps keep my acne under control. Didn't have anything else to add. You guys talked about all the products already.
All right. Well, besides chemical peels, obviously I have my gals who are very well versed with acne, and so anytime a patient comes in, I'm always like, ask these guys because they know they've done it all. But let's talk about other services. Number one, that you can do for acne, but number two, that you can do in the summertime.
Okay. Well, hydrofacial is one of our more so like entry-level treatments. It's great for acne because it's helping to purify the skin, really cleaning out those pores. And then I think the next bump up will be chemical peels after that. And then laser genesis is a great option.
It's my favorite.
Yeah, you do that all the time if you want to talk about.
It helps dry up the breakouts. I feel like my skin gets smoother after I do it. It helps with collagen and elastin production. Jill does it for me all the time. And it just feels like a hair blow dryer on your face.
Just, yeah,
or like
light
you're laying
on
out in
your
the
skin.
sun. It doesn't bother me. It doesn't hurt. And then the next day, the acne it's like dried up. It's more smooth. It's not as I don't want to say juicy. It kills the bacteria and dries up the oil at the same time. The neat thing is it also treats redness. So people with acne typically will have some redness along with it, and it'll help heal those breakouts because it's killing that bacteria, so they do tend to heal faster. But we also use it for sometimes for hyperpigmentation, pore size, and it does build collagen as well.
Okay, so great for acne, but also anti-aging, and there's absolutely no downtime with it.
And rosacea.
And rosacea.
Rosacea.
Right, and let's talk about All Calm real quick with rosacea, but also it's great for acne. So let's add that in. So you had mentioned Color Science, but let's talk specifically about All Calm.
I use All Calm every single day. Like even if I'm not going to wear makeup, I'll put my All Calm on because it helps to take away from the redness, which I do have a lot of redness from my acne. But it also has that SPF in it, so it will provide my sunscreen if I'm not wearing makeup throughout the day. Now I use that as like a primer or a foundation, and then I do put a powder on top of that. And I feel like it provides pretty good coverage. Like I said, I only use Color Science makeup, and it's pretty much full coverage once I get that pressed powder on. All Calm also helps with oil regulation, so if you're producing too much oil, it will help to regulate that production so you're not as oily throughout the day. And then same as if you're a little too dry, starting to use All Calm will help to produce a little bit more oil to kind of regulate that production.
Okay, and I think one of my patients says it best. She says, why do I get acne and wrinkles? It's just not fair. And so a lot of these treatments and all these products that you're talking about helps with the acne, but is also anti-aging.
Yeah.
And no, it's not fair that in our 30s, 40s we start getting acne again, or some or even younger. But there are things that we can do to help. And I feel like it's the same as like melasma. It's not really a one and done kind of thing. It's something that you have to manage and you have to continue, and that's why the at-home treatments, the products are such a great option to try to manage it and maintain that.
Well, with a lot of acne products, they're very drying to the skin. So if they've got salicylic acid or benzoyl peroxide in it, it's going to dry your skin out. And we know that dehydration of the skin is going to cause fine lines and wrinkles and other concerns. So you really want a product that is going to help to heal your acne without drying your skin out and making the aging look worse.
Yeah. And every single one of these gals are up here without a touch of makeup on. I mean, that's what I'm sitting here just looking really at how great your skin does look. I mean, okay, minus the peeling, but that's what's so great about the products, and especially color science products too, because it helps with the redness, or it helps with the evening out, with the Lytera evening out. So the purpose of anti-aging is to not have to wear makeup and to be able to walk out and feel confident in the skin that you have and not have to try to cover it all up. And I personally use Even Up because Even Up helps with the coverage, but it also helps to treat brown spots. So I think, you know, these guys are on a lot of products, and I am as well, but I think that you could do Lumivive and say All Calm, or Lumivive and Total Protection, and have a very minimal amount of products that you use and still see amazing results when you use medical grade skincare. The other thing I wanted to mention is microneedling, because I think we like you said, hydrofacial, laser genesis, chemical peels, and I think microneedling is probably the next step up for a more, and I hate the word aggressive, but it is a little bit more aggressive. It's going to give you change faster. And so in the end, we need to know, do you want just a little hydration, or do you really want to make some change to your skin? And I think you can talk a lot
I
about
think
it.
we're all advocates for micropin here, but I had very cystic acne, but I had, I guess, multiple different types of acne, because I had the cystic acne and the nodules, but I also had pustules as well, and those were the ones that you just really want to pop and get that pus out. And once I did micropin, that's whenever I feel like my skin just really started to turn around. It really helped to heal up my active acne, and then once that active acne was healed, then it started working on the scarring. I'm not going to say I don't get a pimple every now and then, but it has made a dramatic difference with my skin.
And I don't know if you can zoom in, I don't know if you can see this, but this
Oh
is
my
one of
gosh.
the photos.
Yeah,
Can you see it on there?
See that.
Yeah, this is one of the photos that she sent me, and this is what her skin looked like 2 years ago. So what a major
Yeah, you can zoom
improvement.
into my skin now.
Yeah. So a
The
major improvement.
The difference
the scarring.
in the scarring is
Right.
amazing. So she
Right.
also did PRP with
Yes.
her microneedling. That's when we draw your blood and spin out basically what's the white blood cells, and it helps with healing and collagen production, and we infuse that in while we're doing the microneedling.
Yeah, you can do it with or without. We do recommend doing it with the PRP because you see a better result with that, and it helps to heal your skin a little bit faster after treatment as well. I feel like when I did it with PRP, I was a little less red after my treatment, and I healed a little bit faster as well.
I agree 100% with that.
Yeah.
Without PRP, I was red for about 4 days, and then with PRP, I was 24 hours. A little less than 24 hours. Yeah, it was very impressive. But then let's go one more step to the Secret RF, because that one I really expected to be red for a very long time, and it was less than 24 hours. And I did not do PRP. However, you can do PRP with that as well. I wanted to see what that. I believe Nicola always makes me do things without, so that I can see and compare, be the guinea pig. So who wants to talk about Secret RF?
Yeah, vote.
Okay.
So Secret RF is, we brought that in April, I believe. I love Secret RF. So basically, it combines two of our favorite treatments here. So we have microneedling, we also have Therapy, but it's like those two treatments combined and taking it to a whole new level, because it's going a lot deeper, it's got a lot more heat, it's a lot stronger. So basically it's the needles from microneedling combined with radio frequency heat, and it's distributing that heat deeper under the surface of the skin, creating these little micro injuries, and the heat is causing a lot of collagen production all at once. We do those treatments monthly, so you do a series of 3 every 4 weeks. It's awesome because you can do it in the summertime, and you're very red when you leave here. By the next morning, most of the redness is completely gone. The Color Science sunscreen and makeup can totally cover it up, and you're comfortable going to work, you know, the very next day, which is awesome. And it treats face and neck for the full treatment, but we can also do we can do tightening on the body. We can do the knee, above the knee area. We can do a lot of different things with it. We're seeing amazing results. It's awesome.
Yeah, we're super excited about that one, and I think I probably mentioned every show that I don't like downtime, and so that's why I love Secret RF. And it's not painful at all. We put some topical on, and I feel like you just get so much for it. And like you mentioned, you do full face, neck, and we did décolleté. And I just feel like it's you get a lot of bang for that. For
the
that
tightening, the minimization, and like the crow's feet, a little lift with the brow. These are just some of the areas where the results are just huge. Nasolabial folds, and also jawline being so much more defined post-treatment is huge.
Yeah, because microneedling is what's helping with the overall texture and tone of the skin, and then that radio frequency is what's helping to tighten and lift. Is that right?
Yes. So you're getting surface change with the pore size, fine lines, and wrinkles, but then you're also getting the tightening and lift with the radio frequency.
Well, I am super impressed with these three. I didn't even need to be on the show at all. Look at the knowledge. And I think that's one of the things that I want to point out is that every single one of my team members is so well versed in everything that we do. And of course, they have to be the guinea pigs too. They have to try it so that they understand it and get great results with it. But I'm so proud. I'm like a proud mama right now with, you know, sitting here talking to these three and how educated they are. And I feel confident that, you know, well, I've never doubted, but I feel extremely confident that when you come in, and if you don't happen to see me, but you see one of these, or even on the phone, they can tell you everything you need. And if they don't know, then they find out. But I love listening to Allison. I mean, I love listening to all of them, but Allison just is, it's kind of like when you come in and you talk to Nicole, she knows everything. Like, you guys know everything.
And she has a good, like, teacher voice.
Yeah, teacher voice. So, and let's get Nicole in here too. We bring some of the photos. 2 weeks ago, we did photos. You're fine. You can't leave yet. We did a video of my before and after photos, and when we looked at it, you really couldn't see it. So we're gonna try again. And Chantel's face right now is like, oh my gosh.
So I'm gonna keep this photo. This was I wanted to show the before and after of a peel.
Yeah, come on. Oh yeah, we're gonna do before and after first.
So this is a patient that a couple years ago did a series of 3 vitalized peels, and so I like to show her because she lets us use her pictures because she's had amazing change in her before and after from a series of chemical peels. And so she was also using skincare. Can you see it very well? Okay, good.
You can see it in the
good. And so that's why I wanted to show this first, just because I know we were talking about chemical peels today and how much change you can see just from a series of peels. Can you see that?
You see it pretty well? Good.
Yeah. And so she's got really nice change in her coloring and overall texture and everything. So I wanted to start with that. Let me show you.
No, that was vitalized.
This was 3 vitalized.
Okay. Oh, those are great.
And and then I had pulled up doctors before and after.
Yeah, so hopefully we can see those a little bit better.
So
you want to sit up here?
Yeah. Let me sit.
Come on up.
Okay. So I love this before and after because just looking overall in her jawline, here and here is much tighter. Her eyes, her brow, she has a nice brow lift. Even her jawline down here is much tighter. I hope you can kind of see it. It's very, and she's very early on her treatment, but there is some subtle changes.
Okay, hang on. We're doing a camera change real quick.
And then I'm going to actually.
Thank you. No, you did great.
I'm going to zoom this in. So really being able to zoom in and her brow lift, how much lift she has from her oral therapy so far. And she's now done 2 Secret RF treatments, I believe.
Well, the first one was kind of a wimpy one. So
okay.
The second one was really the first real treatment, which was just 2 or 3 weeks ago.
And then we just took these photos today. So this was today, and this was actually, so she is 6 months from oral therapy.
Yeah, from oral therapy. And I did an oral therapy that day too. So most of mine is product and Botox, and then I do my old therapy every single year. And then now with Secret, I will make sure I do a series of those right now, and then we'll maintain those probably quarterly, I think, with Secret. And I think really the protocol though is annually, right? But I feel like it doesn't hurt to, for me, I want as much collagen as I possibly
And
can
we
have.
can do, it's kind of like microneedling, you can do maintenance quarterly, or if you wait a year, then really you should do,
Sorry about that.
it's like microneedling, you, as far as maintenance, you can do maintenance quarterly, but if you're gonna wait a year, then you really should do a package of 3 monthly, but best just to stay on that quarterly regimen.
Okay, well, I think we covered so much today, and we can, if you have any questions or concerns. Sorry, my camera lady has switched again, and now she's being silly. But anyway, if you have any questions or concerns, give us a call or schedule a consultation, and our phone number is 618-288-9117. Thank you.